Can schizophrenia medications impact heart health? Have you ever wondered how medications for schizophrenia might affect heart health? It's a question that many people ask, especially since heart health is so important for everyone. Let's break it down. Medications used to treat schizophrenia, particularly antipsychotics, can indeed impact heart health in several ways. Individuals with schizophrenia already face a higher risk of cardiovascular disease. This is due to factors related to the illness itself, such as cardiac autonomic dysfunction and a greater likelihood of metabolic syndrome. Metabolic syndrome includes conditions like obesity, high blood pressure, and diabetes, all of which can lead to a shorter life expectancy. Antipsychotic medications are crucial for managing symptoms of schizophrenia, but they can have both direct and indirect effects on the heart. First, let's talk about direct cardiac effects. Some older antipsychotics, known as first-generation antipsychotics, can cause irregular heartbeats by affecting heart ion channels. This can lead to something called acute interval prolongation on an electrocardiogram, which may result in serious rhythm disturbances. A second-generation antipsychotic called clozapine has been linked to cardiomyopathy, which is a disease of the heart muscle. This condition requires careful monitoring. Now, let's discuss metabolic side effects. Many second-generation antipsychotics can worsen metabolic profiles. They can lead to weight gain, insulin resistance, and lipid abnormalities. These changes can increase the risk of developing cardiovascular diseases by promoting obesity and type 2 diabetes. When prescribing these medications, healthcare providers must weigh the risks against the benefits. Antipsychotics play a vital role in reducing psychiatric symptoms and improving adherence to medical care. This can, in some cases, lower the risk of death from cardiovascular causes. Regular cardiac monitoring is essential for patients taking certain antipsychotics. Yearly electrocardiograms are recommended to catch any early signs of cardiac side effects. Decisions about whether to continue or stop a medication with cardiac side effects requiring careful evaluation. It is important to consider the risks of heart complications versus the risk of a psychiatric relapse. Collaboration between cardiologists and psychiatrists can help optimize treatment and reduce cardiovascular harm. In summary, schizophrenia medications, especially antipsychotics, can impact heart health through direct cardiac effects and worsening metabolic risk factors. However, their use remains essential for managing schizophrenia, and careful monitoring and teamwork in healthcare can help manage these cardiovascular risks effectively.